So what I really feel bad for, I know there's, for every person that comes here and gets it fixed, there's probably 50,000 that'll never even think about coming here. They'll either have some crappy dentures like my dad had his whole life, or they'll just do what I do. They'll just suffer and eat what they can. And I can't tell you how much, there's the other thing, I can't tell you how often I choke. I choke all the freaking time.
Well, that's not good.
And it's choke because I can't chew enough.
Yeah, you can't masticate the food properly.
I chew at my front teeth.
And they're not designed to chew at the front.
Right. And
you swallow too large of a portion.
Correct. All the time.
Yeah.
I would say on an average of a couple, 3 times a day. I've learned to relax and cough things up.
Yeah.
And that's not a way to live.
Is you ready for this?
My question is, are you
Of course, always. Oh yeah. Okay, so here we've got our patient here where the teeth are actually fine. If you'll notice here, the teeth are okay. However, it's the supporting structures underneath, the bone and tissues, that's not okay. You'll notice the mobility here of the teeth, down here. I mean, these are basically ready to just come right out. So, and it's everywhere. So there's no way to save this situation or try to restore his natural teeth. So we're gonna go ahead and get started and remove these teeth, which is gonna remove the bacteria, remove the infection, and it's gonna really help him even systemically, because having this bacteria and infection in his mouth long-term or chronically is not good. It can trigger a stroke, heart attacks. It's just not good to have this in his system all the time, lingering in his mouth. So we're gonna go ahead and get started. Everything looks good and his bite looks good. And so we're done for the day. It's good. This case is really challenging because he lost the bone all the way to the tip of the root, which is 12 millimeters or more, 15 millimeters of bone. And so it's a challenging case, but we can handle anything. We can, that doesn't stop us. It doesn't really delay anything. We're able to manage and grafting is critical, and it's important that we know how to do that in order to handle these sort of cases. And so even though he had lost all that bone, I'm very confident in regenerating that bone so that I can ultimately give him a fixed permanent set of teeth that will last him the rest of his life. Nice 8-hour surgery today, and now we're done.